my last question for you is around like, do you have any advice for students who are thinking about going to public health, who are currently navigating their programs? Um, with everything opening back up in the US, at least with COVID, things might be a little different. And just thinking globally, like the world situation is still so unstable right now with COVID. So just curious if you have any advice. And I'll kick it to Cindy if you are open to starting first.
Yeah, of course. I think in terms of advice for people who are not sure as to whether they want to get involved in public health, I think public health is, I mean, obviously it just lives within us, like it's our surrounding and everything. So I think if you're just thinking about it, like definitely go ahead, look more into it, talk to professors, like watch a podcast or something like that. And I guess learn where you're interested in, especially in public health, whether it doesn't have to be too specific, but just whether it's like globally or at the community level, institutional, or at the individual level. Yeah, I think that's always a good starting point, especially because I think public health, usually when people ask me, what is public health? It's a very loaded question. Like public health is a lot. So it usually leads into a discussion. So just being able to explore where your interests lie. And obviously, if you want to apply for like an MPH or anything, I highly recommend doing that. I think there's so much you can do in public health. Especially in this program, I've met a lot of like various clinicians and like practitioners and also people working in the community. It's very diverse. There's also people working in architecture and social media marketing, which is very interesting, but I think you can just do a lot with public health. So there's that with a master's degree. And yeah, I just think in general, you can definitely implement public health into your career, whether like regardless of what field that you go into. I think you just have to find a way to do that, but I think it's very possible.
Ellen, would you like to go next?
Sure. So I guess I have a couple thoughts for students and then one kind of like a broad comment for educators. And I guess maybe I'll actually start with the educators one. So going off of what Cindy was saying earlier about, the kind of, introductory / intermediate epidemiologic and bias statistics classes feeling a little bit like there's a tension between it's either really basic or like a little bit more information than you feel like you need to know. That's something I've thought about a lot in kind of the introductory statistics courses I remember taking from undergrad up till now. And I guess part of what I've been, just reflecting on is I feel like in our world where we're just faced with so many different, charts and statistics and like we're presented with so much data or summary statistics, right? And I feel like really the key for people who are not the ones who are going to be going and building the mathematical models or like doing the analyses, which is honestly most people, right? Is honestly, it's just having a better sense of statistical BS, right? And having a sense of like, what questions should you be asking if someone shows you a graph or says like, we built a model that did this, like what sorts of questions should you kind of like have at the forefront of your brain? And, some of those I was thinking about are like, thinking about who was actually in the study, like selection bias is something we talk about all the time in public health. Or, if someone says they, built a model that's able to predict with whatever accuracy, like, did you, validate that on out of sample data? Or was that like, is that kind of metric on your like data set that you trained on? So could you be overfitting the model? Even if you don't have really technical understanding of like what that means, just be able to ask kind of like, internal versus external validity here of the patterns that you're seeing. And then also just something that I had frankly not encountered until I got to the Chan School and was taking that like Epi 201, like our introductory class that everyone takes, was I had not encountered a DAG before. And, just that really clear diagram way of describing like, what is a confounder or what is a collider? And just having a sense of how those things work in a very visual way is something that, I actually think that like plenty of undergrad STEM students would benefit from it too. But, just in general, I think being able to, and again, I realize that's like a huge ask, but kind of reforming our like introductory / intermediate statistical classes for people who are not planning on like, going into statistics, but just who need to be data literate in this world where we're inundated with data and statistics all the time. So that's kind of like a thought in terms of the educational piece. And I actually do think that could start, as early as undergrad or even ideally in high school. Like it still seems silly to me that, we prioritize pre-calc over like basic probability and statistics. Anyways, that's a tangential conversation. But for students who are, maybe considering public health or who haven't considered public health, but who might be interested in trying to kind of, explore some of these things, I think that, from my experience, my undergrad major was in a college of engineering. So people were, pursuing a lot of like technical skill sets in engineering, computer science, math. And I think there are a lot of people who genuinely wanted to help other people in their lives and careers, right? But I think a lot of people just were not aware of either kind of like public health in these fields that really can sit at the intersection of kind of like technical work and more, social behavioral policy work, or maybe just didn't have as much of a sense of, and this is something I definitely, developed and continuing to develop over time, but a sense of, okay, having the technical skills is one important piece if you're trying to do analyses, but also having, if not domain expertise, at least solid domain familiarity with one or more fields is just critical, because it not only can help you in technical work, like obviously if you're trying to model like air pollution that people are exposed to, you need to know something about, how different pollutants work, but even more on the kind of just, what sorts of questions haven't been asked yet, or what sorts of questions would it be possible for us to ask that would be relevant to policymakers. And I think that that disconnect between, what are the tools that we have, what's the type of data that we have, and what questions like could we be asking that are not just like, the scientifically interesting questions are one thing, but the ones that like really will address what policymakers and what community members are interested in, like that's a transition that I think it's hard, especially as an undergraduate student, but even as a grad student, to be asking. And I don't know, to the extent that like individuals or educators can be kind of like helping people cross that divide, I think that's critical for moving forward.
And Ruhi, do you want to bring us home with the last advice piece?
Sure. I think for students, especially those who are currently doing their MPH, for me, the piece of advice would be question the status quo. I think for me, something that really stuck out to me, especially going through the program, was as a woman of color, having 44 professors over the course of only 3 semesters, because health management is 3, not 4 semesters. Only 5 of my professors were women of color. And most of them were taught classes that I chose as electives, not those that were required by our program. And it goes without saying that institutions like Harvard need to invest more in professors of color. But beyond that, I think students need to ask questions. Why aren't there more professors that look like me? Why aren't there, why is that? Why are there certain opportunities that are afforded to me as a student? Is it because of my privilege? What am I doing with my privilege? I think I completely echo Cindy that there's so many things that you can do with public health. It's an incredible field. I think as a student, we have an opportunity to start our careers by asking these questions, by holding institutions accountable, by holding professors accountable, by holding each other accountable, and starting our careers that way to hopefully set a precedent that we can always be this way and continue to not only hold each other in all of public health, but wherever we go, whether it's consulting or nonprofit or whatever it may be in academia, to create this culture of accountability and the idea that we can't hold things like institutions accountable because there's a name brand attached to it, I think is not okay. We're students, and we need to ask those questions and not just accept the status quo as it is. So I think having that awareness that as a student you have that kind of power, I think goes a long way.